Well, Dr. Roizen, after having had a chance to speak with you on the radio, I'm really pleased to meet you. I'm a great fan of all of the things that you're doing and the things that you're doing with Mehmet Oz. I'd like to ask you a question, though.
I don't know if I'm going to allow a question. That was such a good introduction that I don't want any more said.
Okay. Well, help me edify some other people then, because I know a lot about you. Recently, Time Magazine did an extensive piece on the Cleveland Clinic. And what they talked about was this doctor doesn't want to see you. Now, I met a lot of doctors, and I've always found that they would like to see patients for a couple of reasons, and one is that it helps support the whole business that they're in. You are chairman of the Wellness Institute at the Cleveland Clinic.
Correct.
And chief wellness officer. Correct? Explain what that covers.
What the mission of the Wellness Institute that I help lead, or that leads me, if you will, is to make preventive care, and there's a key phrase in there, to make preventive care, and I'll come back to what I mean by that, because in the current healthcare reform debate, that term has been hijacked by people who don't know what it means. But to make preventive care a driving force in medicine for our employees, our physicians, our patients, and our communities. And what that means is we want to decrease the burden of chronic disease in our workforce, amongst our physicians, amongst our patients, and in the greater communities. What do I mean by that? Well, 75% of the total cost of healthcare in the United States, we're twice as expensive as Europe, 3 times of Asia, but it is 75% of our costs are due to chronic disease that is preventable with 4 activities: getting rid of tobacco, being physically active, choosing the right foods and portion size, and managing stress. So those 4 things make us less competitive for jobs and lower our standard of living. So if we could get rid of those 4, in 3 years, we could drive our costs down from roughly 17% of gross domestic product to 8.5%. That's a huge thing. It will change our competitiveness. It would allow us to give, if you will, care to everybody who doesn't have it about 10 times over. That's how huge we could do it and not have a deficit. We would literally change the entire cost structure of government and Medicare and Medicaid and state governments as well, if we as individuals took responsibility. So what we started here at the Cleveland Clinic is a model of how we can capture our patients' imagination. Why do I say that? Because everyone knows you should exercise. Everyone knows you should eat healthier. Everyone knows they shouldn't smoke or go around secondhand smoke. And a lot of people know they should manage stress, yet we don't do it. So what we're doing here is seeing, can we, by making each of those things easy, by having the right leadership. Toby Cosgrove's a brilliant leader at being able to teach people why this is important for us, why it's important for our society, and get the aha moments that get them to do the things for 3 weeks so they feel so much better, they continue it, so that we don't have the burden of chronic disease. And that's what I wanted to get back to preventive care. Yes, preventive care can be doing screening tests. Those aren't worthwhile. Everyone knows that screening tests that is in low-risk populations don't make sense. You want to do, if you will, high-risk finding tests. The mammogram in the woman over 45, that's a high-risk finding test. Or specific tests in people with risk factors for disease. But what really preventive care is it's taking the person who is at risk for diabetes or who has metabolic syndrome and hasn't been hospitalized yet and reversing that disease so they don't ever have it as a burden to themselves or to society.
So if we practice a wellness paradigm from preconception to 100 plus, then we very likely won't have to worry so much about healthcare costs and how people are. It'll be wellness, and that's what we're all working towards.
If we do that, and even if we pay primary care physicians 3 times what they're making now to do lifestyle treatments, we lower the total cost of care in the United States by something on the order of 1.9 trillion over 10 years. Or what that means is we can reduce the cost of care by clearly 25% without hurting anyone and with helping you feel healthy. And if we did that throughout society, we could reduce costs of care, the burden of chronic disease care, by 75%. And we could take all the jobs away from Europe and Asia because we'd be so competitive for jobs.
Well, I look forward to talking to you more about how we can accomplish that. Thanks.
Look forward to it, Lyle.